news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy, sex.
Sex? Did you say sex?
As prescribed, take your medication, exercise, and diet. On 88.5 Sufra FM, tell a friend, call your neighbor. Casualty 911 is on.
Good morning, everybody, and welcome to a new edition of Casualty 911 on 88.5 Super FM. As always, it is a pleasure to be here with you on a Monday morning. I am your host, Fawn Minviel. We apologize for the late start. We had a bit of a technical issue this morning. Welcome to our new listeners. Those of you joining us for the first time, we hope that you will stay for the hour. We have a wonderful guest with us this morning. For those of you who tune in regularly, thank you for making us your choice on a Monday morning at 10 a.m. So this morning, well, let me start off by saying that last week when I was here, we talked about so many different observances, and we also talked about the fact that World Hypertension Day was coming up. So World Hypertension Day was on Saturday, and this morning we are going to continue our discussion on hypertension. We will be talking with our guest. For those of you who go often to the Sufre Hospital, or you have been to wellness centers anywhere between Sufre and Vieux-Fort, you may be familiar with our guest. But before we start off, I am sure he would like to introduce himself, say a little bit about himself. We have with us this morning Dr. Mervin Mark. And for those of you in the Sufre area, I'm sure you know him very well. You see him quite often at the hospital. So he will be joining us this morning, and he will be talking with us about hypertension, all the ins and outs of hypertension, what the blood pressure actually measures, what are the complications. We'll be talking about some of the some might say myths, some might say beliefs that we have in the society as it relates to the condition, and as well as the beliefs that we have about the medication and why we make certain decisions as it relates to prevention or reducing the risk of hypertension, as well as managing the condition. So welcome, Dr. Mark. It is a pleasure to finally have you on 88.5. It's been a long time coming.
Thank you, Ms. Manville. I'm happy to be here this morning. As has been said, I am Dr. Mervin Mark. I'm a district medical officer. I serve in what we call regions 5 and 6, which means health and wellness centers from the Vieux-Fort and Sufre regions. I really enjoy this work. I serve a wide sector of the community, of the society. A lot of persons with hypertension, diabetes, and other chronic conditions. And of course, today we're here to share and discuss, and hopefully all of us can learn something today, Yeah, I look forward to the discussion.
So I would not say that this topic is a new topic, that we have never spoken about it on the radio program. However, having you here today, I am sure we are going to get into a lot more detail and get explanations that we have not heard before. So we will start off, people, when we talk about blood pressure, the first thing people think about is actually high blood pressure. But before we get into the high blood pressure, I would like for you to explain to us what that blood pressure is. What is it measuring, and why is it important to measure it?
Right. So I will attempt to first help us understand what blood pressure is. So all of us would appreciate pressure because we receive water in our pipes, in our taps. Every time you open the tap or the faucet, Getting water out is dependent on pressure. You must have some amount of water pressure, adequate pressure to get that water in. And you will say, boy, that pressure, the water pressure is low because the volume you get out is really low. And or if the pressure is high, you'd say, wow, there's a lot of water today. But if the pressure is very high, you might see the evidence somewhere on the road, some pipe has burst and Wasco is repairing it. So pressure is important, and pressure is dependent on a couple of things. We can say, especially in terms of our heart, it depends on the blood volume, the pump, which is your heart, which is constant, and the tubes that the blood is going to go through. So the pump, let's imagine the pump is constant, though it can vary vary with physical activity, etc. How many times beats per minute and the strength of each beat is the pump activity of the heart, and it pushes blood through the blood vessels. So you would appreciate that if it pushes blood through a very big vessel, a large vessel, the pressure would be a certain thing. But if you must push that same amount of blood through a narrower vessel, the same amount of volume passing through that smaller tube, the pressure would have to be higher. And so typically we are designed with an adequate pump and adequate vessels, everything correct. But through the various circumstances that we may discuss today, things change. The pump changes a bit, and the tubes, especially the tubes, which are our arteries, those change. They tend to become narrower and stiffer, and that causes our pressures to go up. Talking about the importance of measuring blood pressure, it's the only way to know. The only way to know what your pressure is to measure it. We cannot predict our blood pressure based on how we feel. Very inaccurate. Sometimes it may coincide that you I have a headache, and you believe that your blood pressure is causing the headache, but it might actually be the reverse. It might just mean that because you have a headache, which is pain, that pain response triggers your blood pressure to rise a little. So you have an elevated blood pressure. So it is just very misleading to believe that because I feel okay, my blood pressure is okay. Very wrong. And because my neck hurts, then it means my blood pressure is high. That's just very misleading. So why we should measure blood pressure is the only way to know.
Okay. So you've already started talking about some of the myths, which I like, but I'm going to take you back a little. And let's talk about why is it important for people to actually know, to be able to at least identify the blood pressure number. Is it important that they can actually identify it? Because some people tend to confuse the blood sugar reading with the blood pressure reading, and what to look for in terms of what is normal, what is abnormal, and is everybody's, I know I'm dropping a lot on you, and is everybody's normal the same?
Beautiful, very beautiful question. So everybody's, to begin with, blood pressure, in measuring the blood pressure, we get two values. What we call the systolic blood pressure and the diastolic blood pressure. The systolic blood pressure represents when the heart contracts, and it contracts, so your heartbeat goes on like, where the first sound represents the contraction and the second one represents the relaxation of the heart, in broad terms. So the first reading represents the contraction of the heart, but your blood flow never stops. So when the pump hits, like you have a hammer, it hits, that's the highest pressure reading. And when the hammer retracts, when the hammer moves away from the target, the pressure drops, but the blood pressure never goes to zero because your blood flow is continuous. You understand? Blood flow is continuous. So just that when the hammer retracts, I'm using an analogy here, the blood pressure drops a little, but it never goes to zero. So that second reading, that lower reading, is called the diastolic pressure. Both readings are very important. And so you need to identify what's your diastolic pressure and what's your systolic blood pressure. It has been broadly and accepted that normal blood pressure reading should be less than 120 systolic, that's the highest reading, and less than 80 as the highest reading. Once you begin to go above 120 as your systolic, that's the first reading, the highest one, and more than 80 as a diastolic, we begin to talk about blood pressure being elevated. However, high blood pressure, there are various definitions. In the past, we spoke about 140 over 90, and a lot of times decisions to treat blood pressure are based on those readings, 140 over 90. But newer data and newer standards are suggesting that from 130, 130 systolic is regarded as high blood pressure, and 80 and 85 and above of diastolic is regarded as high blood pressure. So measuring is important. Recognizing those numbers, the diastolic, the systolic, which is the higher reading, and diastolic, the lower reading, we typically write them as like almost like a fraction, 120 over 80. You ask, is every blood pressure the same? No. Some persons, their blood pressure are pretty, maybe they might have a systolic of 110 or systolic of 100. And again, that's normal for them, so you don't necessarily have to panic. In fact, there's actually not a disease called low blood pressure.
Really? I'm glad you brought that up. You know
There
why?
is
Because
not a
anytime
condition.
we talk about high blood pressure, somebody is going to ask, what about when it's low? When is it too low?
Yeah, there is no condition called low blood pressure. Yeah, no, no, no. So I could only, I worked at an ER for some time, and all of us, we need to learn how to manage, emergencies. So if, let's say they had an accident and they bleeding, something happened or they dehydrated and they have a low blood pressure and they have some symptoms, accompanying a low blood pressure, then you'd say, oh, this pressure is low because this person has lost some blood. This pressure is low because this person is dehydrated. So we can take some measures to help, but there is not a disease condition called low blood pressure. So if your blood pressure is low and it's habitually that way, there is no need to do anything about it.
Oh, that's very interesting. because that question comes up all the time. So I'm glad that you mentioned it, because I was about to ask you, when it's consistently, say, at like, I don't know, 85 over 65 or whatever, that sort of reading, is that also normal?
So again, so you color some values here, and they sound like pretty low values, right? Um, Context, I would say context. That sounds like a low value, and if I sit in somebody like a systolic of 85, that's pretty low in an adult. If this person is not on any medicines, not on any so that's the other dynamic we're introducing here. If your pressure is low whilst you're on medicines, then we can say, hey, that pressure is too low. Let's back off some of the medicine. So we'll have to make adjustments to more or less normalize, have your pressure closer to target, because supposedly your pressure was high at one point and we are treating you, and then we have taken your pressure down to 85 systolic. Nah, that's our fault. And then most likely you are feeling unwell, you're feeling dizzy, lightheaded, and faint, right? Because that would be the cause of the medicines dropping your pressure low. But if you are not on any medicines, and you're going about your daily life every day, feeling fine, and your blood pressure is systolic 110, systolic 100, then so be it.
Okay. So let's talk about our topic, hypertension. Is it inevitable that as we, for example, as we age, or certain activities or certain issues within our environment would raise our blood pressures and probably raise them to a level that is above the 120/80.
So it's this question has two answers. I'm thinking in two things. I'm also a how do I put this? But let me answer. So it is inevitable because we firstly high blood pressure. Its classification is classified as a chronic, non-communicable disease, and it's preventable. So it's preventable. How is preventable? For lifestyle. So there are some for lifestyle changes. High blood pressure is considered preventable. It is listed as a lifestyle condition, lifestyle disease. Um, that's one. Secondly, it's also the most hypertensives are classified as primary. It's the type of hypertension is primary hypertension. It's also could be called idiopathic, primary essential idiopathic. All of those terms mean that you cannot necessarily pinpoint and find one exact cause. For example, somebody who develops kidney disease, let's say they have lupus and they develop kidney disease, chronic kidney disease. That chronic kidney disease can be a cause for hypertension. So this person has secondary hypertension, and we know the cause, kidney disease, chronic kidney disease. But most persons with hypertension, we cannot identify one major cause, like one cause, and that's termed essential hypertension. And you're right, as we age, those the risk for developing those conditions increase. And I think whilst we're here on Earth, with the current conditions, it will happen. Sickness is not 100% evitable, but yes, it's termed a lifestyle disease, and there's a lot that we can do to ensure that we live healthy and we can decrease our risks for high blood pressure. Can I speak about some of those lifestyle changes that we can do?
Of course, Dr. Mark.
Yeah. So we generally, and in St. Lucia, I'm happy to say that we've made strides. At least the public, St. Lucians, every St. Lucian has heard about initiatives like St. Lucia Moves, where we encourage physical activity. Sedentary lifestyle and hypertension don't go well together. So we encourage persons to become physically active. The more physically active we are, we decrease the risk for high blood pressure. In fact, persons who are already hypertensive, if they become physically active, that physical activity can help to reduce the blood pressure. And I have met persons who are witness. They say, whenever I exercise, I also lose some weight and my pressure drops. Routinely, you get, the routine thing. So diet is very important. Eating healthy, lots of fruits and vegetables, avoiding a lot of processed foods that are high in salt and high in, in saturated fats and, high in cholesterols and so on. So healthy diets, especially, and being physically active, those two go hand in hand. Weight control, obesity, controlling that, avoiding harmful substances like alcohol and tobacco and others, those who definitely play a role in ensuring that we live healthy lives and decrease our risk for hypertension. Smoking, the associations are clear. Persons who smoke, it affects your blood vessels, those tubes that the blood flows through, and it will, determine that you have an increased risk for hypertension, high blood pressure.
So you would say that these are the key risk factors: diet, physical activity, smoking, alcohol, and what was the other one? I think there were about 5 that you mentioned. I think I missed one.
So you said key, and it brought another word to my mind. We call them modifiable risk factors.
Yes, modifiable risk factors.
Modifiable. So I wouldn't necessarily call them
some control over.
Right. I wouldn't necessarily call them. We can call them key, but as I said, a lot of the times you cannot necessarily pinpoint one exact final cause for hypertension, but those are the modifiable risk factors. So if I can, if I can avoid smoking, tobacco, if I can avoid alcohol, if I can have a regular level of physical activity, routine, I can eat healthily, I can control my weight, I'm well on my way to having a very low risk for high blood pressure.
So when you, Dr. Mark, in your experience, from your practice, from being at the clinics, but also, just being out in society in St. Lucia, how well do you think we're doing?
I believe St. Lucia can do a lot better in terms of high blood pressure control. One, or let's speak about risk factors first.
Yes.
Risk factors. So a lot of persons are still very sedentary. Our society, I see persons who don't, well, I drive a lot, but I try my best to have a routinely being physically active. But I see persons who neglect opportunities to walk, they have an opportunity to walk and they will take a bus from very short distance or ask for a ride for a very short distance. Whereas that walking, that short walk every day as part of your routine would help. So we still have a lot of obesity in St. Lucia, which is a factor. We consume a lot of processed foods. Parents and young people alike, they prefer to go to the supermarket to get some so-called snacks than going out in the countryside in the yard to pick some fruits, or going to the market to buy some fruits and vegetables, So those habits, and I think in the end, or eventually, we need to have some good collaboration between the various maybe stakeholders in society, agriculture and health, and commerce, where we can produce and more healthy foods, wholesome foods, and make those available. So we still have vegetables still being relatively expensive in St. Lucia and inaccessible. So we have to work on our food security. So not just rice and sugar and flour, but vegetables, cucumbers and tomatoes and lettuce, and
The
so
foods
forth.
that can actually help to keep us healthier for longer.
Yes, so right. So I spoke of physical activity diet. I still go around and when I drive, go to the various communities, there are other persons who drive to the various communities. And you know who they are? The delivery trucks, and they deliver alcohol. So whereas I go to the health center to deliver healthcare, in the same route there are other trucks and vans and buses that deliver alcohol, and
And
it's
snacks.
sad. We consume large amounts of alcohol in St. Lucia, and I hope somebody gets the memo that hey, alcohol is not good for cardiovascular health, for high blood pressure. And so yeah, so there are a lot of modifiable risk factors that we can implement in St. Lucia, we can change. And I'd like to encourage at least the listening audience, on the radio, and tell your friends, encourage persons. Let's all adopt healthy lifestyles, and so doing, we can decrease the risk for high blood pressure, hypertension.
Okay. And I'm going to take you back a little to when we should be concerned. When should we be concerned about changes in our blood pressure reading? For example, if you have always had a normal blood pressure reading and then you go, there are all those opportunities for screening, sometimes sometimes at outreach or at the various health centers and so on. And you have this one reading that happens to be very high, and you do it again and it's very high. When should you be concerned? When is it necessary to see a doctor? I know the nurses would refer, but as an individual, at what point should you be concerned? And
So if one has been monitoring the blood pressure, and from the time and that's why let's encourage persons to, even if your pressure is normal, with certain frequency, every couple of months, couple of weeks, you check it and establish a trend. And if your blood pressure, as we said, we established earlier, The normal is less than 120 and less than 80. Once you begin to go to increase above 120 and above 80 diastolic, you should become concerned. Between 120 129, there is usually no need for treatment. In fact, the treatment would be lifestyle changes. It's always the fundamental. If your blood pressure is normal, lifestyle is important to keep it there, to keeping it there. If it's beginning to go up, it's 125, it's 128, yeah, lifestyle. But past 130, past 85 thereabouts, we encourage treatment. We have encouraged, especially if you have risk factors. If you smoke, you should stop smoking. If you drink, you should stop drinking. If you're obese, you should reduce the weight. Those are first line things to do. And in some instances, we may introduce medicines at that point. Definitely above 140 and above 90. If you have, for a single reading that's elevated, we don't initiate treatment. But if you have multiple readings that are above, 140 and above 90, we strongly recommend starting medicines. On top of the lifestyle changes, quitting smoking, quitting alcohol, reducing your weight, becoming more physically active, eating healthy, those are important. But on top of that, we strongly recommend starting medicines.
Dr. Mark, there's something that I've noticed, and I'm sure you may have noticed it as well. Sometimes you're interacting with somebody and the pressure happens to be high, and you're talking about lifestyle changes, and there's this thing that people tend to say, but I eat a lot of fruits and vegetables, I exercise, so it's like they're doing everything right, but the pressure is high. How do you, as a medical professional, how do you deal with situations like that?
Where
So
the person's
basically,
doing.
they feel that there's no need for any lifestyle change because they're doing everything right. However, you can notice that they're probably overweight or obese, and then you're not at their homes, you don't know what they eat, you don't know whether they exercise, but they say that they do.
Well, if one says that they exercise, I cannot tell them otherwise. I can encourage. So what we can do, we can go over. I can maybe ask some basic questions: how much exercise you do, how often do you do it, so we can establish the duration, intensity, and frequency. What is it you do? So adequate physical exercise, should be able to raise. So intensity, whatever you do, the intensity should be able to raise your heartbeat. You should be able it should be able to affect your breathing. So right now I'm speaking to you comfortably because I'm at rest, I'm sitting. But if I begin to walk briskly, then I might have to, my speech may be a little interrupted, because I need my breath. I need my breath in the air to exercise, So the exercise, the physical activity needs to do that. It needs to get you to the point where your heart rate increases and you could feel a little more need for air, you know. That's intensity. The duration, we say at least 10 minutes per session. But for the day, if you can push 40 minutes, at least 10 minutes, but you could do those 10 minutes of moderate intensity exercise that raises your heartbeat. And also, causes you that little, you feel that you need a little more air. Do this for 10 minutes a day, 3 times a day. 10 minutes per 10-minute interval, 10-minute sessions for 3 times a day at least. So you do 40 minutes for the day, and do this every day, and you should be good. So intensity, duration around 40 minutes for the day, but you can split those 40 minutes into different sessions and daily. So yes, I do it, but let's talk about intensity, frequency, and duration. Yes, and the person is visibly overweight, and we can use objective measures to the person. BMI. So we can say, hey, your BMI is 30. That puts you in the obesity range. You're not just overweight, but you're obese at a BMI of 30. So we can have discussions about that. You can be objective based on the weight.
Because
Yeah.
the denial can be very strong.
It could.
Yes. It
Yeah.
can be very so. I always wonder how doctors deal with it, or whether you just increase your dosage of medication or whatever just to avoid that. But I'm very happy to hear that you actually have that discussion and try to convince people to do a little more, or maybe to be sometimes a little more self-aware, because probably sometimes we think we're doing it right, but we may be lacking here and there. So it's always good to have that sort of discussion.
Even you mentioned about increasing medicine doses. Even there, we have to, be careful, because a lot of times the temptation would be to increase a dose, and which is the correct action to do. But we would want to verify: are you actually taking those medicines? And a lot of times, the I'm sure persons listening to me out there can identify that they don't take the medicines consistently, and there is no point increasing a dose or bringing in more medicines to control blood pressure for somebody who is not taking the medicines. Are we allowed to speak pato on the show here?
Doc, feel free. Feel free.
Because mwen sa wala ni moun ki pe ka koute ki ka pale ou sa pato a Creole, so yo eme Creole. An chay moun pa ka pon wimed la. So pito nou pou mene dos la mouti ek ba ou pli wimed. Premier part c'est pour make sure tout le monde capable tout remédio. So taking the medicines consistently every day is one of the important steps in controlling blood pressure before bringing in more medicines or increasing the dose. That's really important. So we are on verifying that a patient has done all the lifestyle changes, or whether or not they're doing the lifestyle changes, but that they're consistently taking the medicines and the pressure is still up. Yes, the next step is to increase the doses.
And I think it's also important to encourage people to always be honest, as you said. Be honest with the doctor. Pas di doktor ou ka pon tout remède la, ek ou pa ka pon. Because the community health aides who go out sometimes, they encounter situations like that. So ale la kayon moun, yo ka de, oui, na pon remède la. Yo de, why pon remède la ba mwen pou mwen we. When they look at the book and when the medication was prescribed, and they look at the number of packages and the number of pills left, it's obvious that that person has not been taking the medication as prescribed.
Yeah.
Okay.
So in St. Lucia, a lot of persons don't like taking medicines. Mon pa me pon wimed. So you can see me boy wimed boagie.
I'm happy you brought that up.
Right. So you see me. So see when you can see me boy, and but it's proven. It's proven that those medicines work. They work, but we do not know. At least I cannot speak about the effectiveness of those bush medicines. I don't know anything about dosage, anything about frequency, or effectiveness. Do they actually work? I have no idea. But the medicines that we prescribe, it has been proven that they work. So be encouraged. Be encouraged, St. Lucians, people from Soufrière. Pon medla, sell money, because why? And and there are a lot of things people say. I don't want my body to get used to those medicines, and they're afraid of this and that and the other. But the issue with high blood pressure, why? Maybe one question we should address is, why should we even be concerned about controlling high blood pressure?
Yes, we will be getting to that. But if you want to jump in right now, feel free.
Yeah, why? Because I'm asking. Yeah, because we're asking people to take medicines. Why? Why take medicines for blood pressure, especially if I'm feeling fine? Because I'm feeling fine. Why take medicines if I'm feeling fine? Ma anye pa ouve, man mal tête, ma tout di, pour que ça man pou pon remède.
And then you find that sometimes they complain that the medication causes them to have those issues, lightheadedness, for the men especially, erection problems, and so many other things. They have a constant cough, or they go to the washroom too often, sometimes they.
Right. So yeah, you mentioned side effects, so let's address them. So different medicines have known side effects. Everything has a side effect, you know. So we that's why we try to use the medicines in doses and combinations that would try to minimize the side effects. So we use doses and we combine the medicines in such a way that the person would have minimal side effects. If you experience a side effect, please say, let your doctor know, let the nurse know, report the side effect so that some adjustments have to be made. You do not necessarily have to live with the side effect. You understand? We can make some adjustments. If it's a cough, a dry, persistent cough, yeah, we can identify the culprit and we can make some adjustments. If you have an erectile problem, we can make some adjustments and we can solve the problem. So you don't have to live without being able to achieve, a proper erection. So yeah, we can make the adjustments. But high blood pressure has been rightly termed a silent killer. It is one of the silent killers. What does silent killer mean? It means that while you're having your birthday celebration, happy corn birthday, say lesser it can strike and bleed it. It could be a stroke. And talking about strokes, one of the things. A stroke is termed and it's an accident. It's called a cerebrovascular accident. And I drive on the road and I'm terrified of an accident. Why? Because in accidents you cannot choose your injuries. Did you know that?
I never thought about it that way.
You cannot choose your injuries in an accident. So if I could have an accident and I only know that the car got damaged, then it wouldn't be an issue. And I only know just a minor scratch on my leg, it wouldn't be an issue. But talking about broken bones, and head injury, you don't know. You cannot choose your injuries. So safety on the road is very important. That's another point here. If you drive on the road, drive safely because you cannot choose your injuries. People die on the road uselessly. Too many deaths in St. Lucia. It's one of the cries in St. Lucia. Too many useless deaths on the road. You cannot choose what happens to you in an accident. So in high blood pressure, the result are you have both acute complications. Those are the accidents, cerebrovascular accidents, accidents in the brain, accidents of the vessels of the brain. You cannot choose your injuries. Some persons they call it a mild stroke, and they're able after the stroke they can go and they can walk and they can go to the farm. Very good. But not everybody has that same fate. Remember, you cannot choose your injuries. Some persons die and never get up. Some persons remain paralyzed in the bed for life and they cannot get up. Somebody has to feed them. In fact, they have to feed them through a tube. They have to put diapers on and they just lost. They cannot go to work anymore. So, you cannot choose your injuries. You have increased risk of stroke, cerebrovascular accidents, increased risk of heart attacks. It's another accident. And again, you say, oh, he has a mild heart attack. A heart attack is a very serious thing. Before you get to the heart attack.
I'm suggesting that we should not be speaking about strokes and heart attacks in those terms as in mild because of probably, I don't know, maybe the damage that is caused.
Yeah, well, I mean, if you want to evaluate it based on the manifestations or how you see the stroke, how you see the heart attack, the functionality of the person afterwards, well, as a layperson, you can call it mild if you want, but the very fact that you had a heart attack means that things are bad. It means that you can have another one anytime. You have a lot of clogged blood vessels because how did you get a heart attack? You got a heart attack because the vessels that feed the heart muscles, those are blocked. And one of them got all completely or almost completely obstructed. And that's how you got to the heart attack. And it's not the only one. There are others also. So the risk of heart attack is high. It means it's so once you have a heart attack, things bad. Your level of functionality decreases, and so forth. So those are you cannot choose. Again, you cannot choose. And in St. Lucia, there are many interventions that can be done in other more developed countries that we cannot do, to manage a heart attack or stroke in the acute setting in the hospital. A lot of things we wish we could be doing here. And so the best thing is to avoid it. And one of the ways is to control your blood pressure. You
Now,
know,
Dr. Mark, speaking about strokes and heart attacks, I don't know, for some reason, being out there, in the community, to me of late, I don't know if if there's any data or anything to suggest that, but it appears that there are quite a few people on the younger side having strokes and heart attacks. As that is something, I mean, growing up, I would expect, older people. So is that something that you have noticed? I don't know if there's any data, that you can speak of, but is it real? Is that thing that I'm thinking, that I'm hearing and seeing, real?
it is real. It is real. It is sad because you have an increasing number of young persons being hospitalized with severe complications of high blood pressure, stroke, and heart disease and so forth. It's sad. And because traditionally we expect older persons to
Yes.
take charge of their health. So while I'm young, I can live free. I can become as obese as I like, and that's fine. I can drink all the alcohol I like. I'm just a social drinker. It's okay. I'm fine. I can smoke. I can smoke. By the way, all smoke is bad. Can I drop this little point here? All smoking is bad. So I can smoke tobacco and I can smoke weed, and it's fine. But the complications, your body is delicate, and you keep bringing injuries. Those injuries add up, and one day, you will have to answer the question. And so yeah, it is sad, but we see a lot of young persons. So two factors might play is that one, we believe that because we're young, we don't have to take care of ourselves. We don't even have to check our blood pressure or our sugar. Leave that for the old people. And secondly, our lifestyle. The lifestyle that we take on as younger persons in society are just not becoming, and they increase our risk of having those conditions. Yeah, so definitely for our younger listeners and for parents and other persons who are responsible for young persons, encourage the young people around us to live healthy lives, because it doesn't make you don't start being healthy in your 50s. You must have been healthy, having healthy lifestyles in the childhood stages. So I think there are also other great initiatives in the schools to reduce the consumption of sugars and stuff like that, and encourage physical activity and healthy lifestyle. Yeah.
And there's something that comes up a lot at schools, and I would like you to at least tell us a little bit of whether you think it has an impact, and that is the lack of sleep. And you see it from very young. So children at school, usually because of the devices, you get hooked on them, and by the time they check themselves, it's 2 in the morning, 3 in the morning. They're not
Wow.
sleeping
Wow.
adequately, and also because of the lifestyle of older young adults, the partying, the going out, and all of that. A lot of people lose sleep, sometimes through work as well, because you work a lot of night shift, and when you're at home, probably you don't sleep because you have so much to do, so your sleep is reduced, and probably the quality of sleep as well. So would that have an impact on our blood pressure and contribute to high blood pressure?
Definitely, because the cycle of rest and wake is really important, in rejuvenating the body and keeping our mechanisms working well. So, so you have more stress hormones being released, and so forth. So definitely not resting well means that we are under a lot of pressure, a lot of stress, and that stress, stress hormones being released, definitely plays a role in increased blood pressure. And of course, you have so the device, not just the device, but it's the inactivity. So with the device comes more inactivity, more obesity, and so forth. So yeah, it definitely plays a role.
Okay. So we spoke about the acute complications, the stroke, the heart attacks, and now I think maybe we can speak a little bit more about the other complications that may arise due to hypertension, and probably let us know which of those are most common in your experience in St. Lucia.
So, let me tell you, hypertension, which is our focus here, affects every organ system in the body. You know, in the brain, you could have, of course, with most of the things we are acute, but before you get to the acute, they're predisposing factors. You could have aneurysms being formed, and so on in the brain. So you have changes, atherosclerotic changes. So the blood pressure, high pressure, which forms a constant insult on your blood vessels. Those would cause progressive, together with high cholesterol, and maybe diabetes also would cause progressive narrowing of the vessels in the brain, in the heart, and other places. So you have constant injuries, changes those vessels, changes the lining, because narrowing and so forth. In the heart, you also have, you could have heart failure. It's called a hypertensive cardiopathy. So you have raised high blood pressure, because it's amazing. Your heart has to pump. It generates the pressure to get your blood vessels, but if the pressure is high, that high blood pressure becomes a load that the heart must push against. You have to push against that load, and pushing against a constant heavy load, the heart becomes enlarged. Initially, it's to its advantage, but after a while, that enlargement works against the heart. It beats ineffectively, and that ineffective, being unable to meet the body's demands, it's heart failure. So signs of heart failure a lot of times is fatigue, inability to work, do physical work, exercise, cardiac function. You could have swelling in the legs and so forth. So in essence, your heart becomes unable to supply the demands of the heart, especially of increased physical activity. So that's heart failure. You could have complications in the eye, from bleeds in the eye, and swelling of the eye. That's the retina, the back of the eye, the sensory part of the eye, the sensor, if you want to call it that. You could have injuries to the retina. And those injuries are not, you cannot fix them with glasses, once they happen, now with technology, advanced technology, some surgeries can be done, but already, that's why, when you say mild, those some things are not mild, because it's mild. Using mild doesn't change the fact that it's a serious complication, so once you're having bleed in the back of your eye, that's serious. That's serious. And we go down, that's the major organs. Another major target organ will be your kidney. In the kidney, you have all kind of injuries. Your kidneys supposed to filter out proteins, or in other words, no protein supposed to pass. So you begin to have protein leaking into your urine, and gradually that leads into chronic kidney failure. And chronic kidney disease is another serious problem in St. Lucia. When you get to a certain stage, you need dialysis. Dialysis is expensive. It changes your life. There are not sufficient places in St. Lucia. So we have a lot to protect when we take care of our blood pressure, protecting our kidneys, protecting our heart, protecting our eyes, our brain, and every other organ system in the body. But those are the major ones. The major target organs, and that would suffer injuries, both acute and gradual. Because you could have acute kidney failure, but most times what we have is a slow gradual injury causes.
That's really very scary, to imagine that so much damage can be happening inside of us and we feel well. We don't feel, any of the effects of that damage until it's probably too late. So that is very scary. I don't know. I think sometimes we just take it for granted that if we feel well, we are well. And, maybe we really need to rethink our health and how we maintain a healthy lifestyle. And, all of us, I don't know if I can speak for you, but I always say, all of us, there's something that we can improve. No, nobody's doing it perfectly well.
Right, right, definitely,
Yeah, so
definitely.
that's very enlightening, Dr. Mark, and I I hope that all of our listeners are starting to, think about their lives individually and what changes can be made, because we really don't want to end up, as you said, with all of those complications. Our healthcare system is not, as advanced as in other places, as you have mentioned. So, something that probably could be dealt with relatively, I guess, easily elsewhere may cause us to have a very significant change in the way we function.
Yeah, but
Yeah.
even if we were able to treat, you know, at higher level, like those tertiary level institutions, where so somebody's having a heart attack and you can go in, put a catheter and put a stent right away. Even if we could have done those things, you're much better off just not getting that, just not getting to that point. It's so much better never needing to go to that cath lab and having a stent placed, and so on. It's so much better never having to have a clot removed from your brain, whether surgically or chemically. So it is just so much better. So for us in Saint Lucia, you know, our society, whether we become more developed in the future or not, but I would say prevention, like the old saying, is better than cure. Better. Let's live a healthy life.
So pou se moun la ka toujou di dokte jes la pou la hanzot, ezotan Dr. Mark. Prevention is better than cure. So, I pa mèm gade pou mene la han bali. He wants all of us to take care of our health, do the things that will keep us healthy. Right, Dr. Mark?
Yes, definitely. That's what it's about. I think everybody would be happier, if we have a healthier society. I think that's what we need: a healthy society, healthy people.
And as the theme says this year, measure your blood pressure accurately, control it, and live longer. And not just live longer. I always say, live better for longer. Because
Right.
what is the purpose of living longer with a really reduced functionality that you can barely do anything for yourself and so on? So we want a good quality of life as well as the length of life.
Correct.
Yes?
Correct. But I think generally in places where people live long and free of those chronic diseases, their quality of life is also better. Also better. So yeah.
Absolutely.
So let's control our blood pressure. Measure it. Why measure? Because it's the only way to know.
The only way to know.
Don't trust how you feel. Don't trust how you
Yes.
feel.
Only way to prevent, only way to reduce the risk of all those complications. So, Dr. Mark, thank you so much for joining us on the program this morning. It was a pleasure having you. I have been looking forward to that day for a very long time. So
Pleasure was mine. Thanks.
uh,
And
I
thanks for
hope
the
that the
opportunity.
experience was a good one, and you will look forward to joining us on the program again at some other point in time. I really appreciated all of the analogies, the way you explained things and broke it down. And I think that our listeners and viewers would have appreciated that as well.
Thank you. Thanks for the opportunity. Yes, I look forward to another one, to share on maybe a different topic or the same one. Doesn't matter. But yes, and lotions out there, final message. Let's do our best to live healthy, practice. Let's identify those things we can change, modify, to decrease our risk and control our blood pressure so that we can live healthy and long.
Yes. So I think those are wonderful final words. So with that, we will end the program. Thank you again, Dr. Mark, and thank you to all of our listeners for joining us on 88.5 Super FM this morning. Please join us again next week, same time, same place.